So let's move on to the role plays now. I'll take the part of the patient or perhaps a relative, and you'll take your professional role. Each role play will last 5 minutes. The purpose of the role play is to get evidence of your ability to communicate effectively with patients. Use your ability to fulfill as much of the role play as possible. Do you have any questions?
No.
Okay. You have up to 3 minutes to prepare the first role play. You will start the role play after that time. I'll let you know when 3 minutes are up. You can ask me if there's anything you are not sure about, and you can make notes on the role play card if you want to. Here's a pencil for making notes.
Thank you.
You can look at the card during the test, but you must return it to me at the end of the test. This is your information for the first role play. It's role play number 1 for medicine. Please start preparing now. Thank you. The role play will now last for about 5 minutes. Don't worry if I stop you when the time is up. Can you start the role play, please?
Sure. May I just confirm your name and date of birth, please?
Certainly. My name's Rebecca, and my date of birth is the 15th of March, 1978.
Thank you, Rebecca. I understand that you have just been discharged from hospital 2 weeks ago. Is that correct?
That's right, yes.
That must be very difficult for you.
Yeah, I'm happy to be home, and I'm feeling much better than I was 2 weeks ago, but I am feeling really quite tired, and I'm a bit worried about that.
Sure. Can you tell me a little bit more about the treatment? I understand that you had a mild anterior acute myocardial infarction, and then it was treated in hospital.
I had a heart attack.
Yes.
And yes, I was in hospital.
Did you have any procedures? I'm trying to understand whether you had any surgeries or you had...
No, I didn't have any kind of operation. They gave me some medication, and that made me feel better.
Right.
And they hooked me up to some machines. Yeah.
Right. So the tiredness became 2 weeks ago when you returned home from hospital, is that right?
Yeah, I suppose after the heart attack, I expected to feel tired, but the tiredness hasn't gone away. So I feel quite anxious that maybe this is the new normal for me.
Sure.
That I'm always going to be tired.
Sure. Are you getting enough sleep at all?
Yeah, sleep. Maybe not quite as much sleep as I did before the heart attack, but yeah, pretty good.
How many hours on an average work day?
Well, I like to have 8 hours sleep every night, but I think I'm waking up maybe once in the night at the moment, so it's not complete 8 hours.
Sure. How long does it take you to go back to sleep if you're woken up during the night?
It can take a while.
Right.
Depends if I've got something on my mind.
Sure.
I put the radio on. That helps.
Yeah. And before the heart attack, you never felt like this?
No.
So this is new.
And the heart attack was completely unexpected.
Sure.
So,
Yeah, understandable. Well, in hospital, they would have done all the necessary investigations to exclude any underlying or unrecognized illness that would be contributed to your tiredness. So let me reassure you that this is purely due to the normal bodily reactions once the body undergoes such an event as heart attack. So it is normal that you will be feeling a bit tired for the next few weeks, but eventually we are expecting that your full energy levels will return.
Oh, okay. So this isn't going to be like this forever?
Absolutely not. And that is why I would like to address something else with you that will help you with not feeling tired for a long time. It is called Cardiac Rehabilitation Program. Have you heard about that?
I think they mentioned something about it in the hospital, but because they talked about walking and swimming, I didn't think that was such a good idea because I don't want to have another heart attack.
Sure, yes, absolutely. Well, cardiac rehab is all about graduating that necessary exercise levels that you would be able to tolerate, that you would not be getting any chest pain or what we call ischemic pain, that is what causes the heart attack. And by graduated exercise, the circulation in your body will improve, and that will not only make you less vulnerable to ischemic events, but it will also improve your overall feeling about yourself, as well as the very just by being able to exercise, you would not be feeling tired as you're feeling now.
Okay, I do worry though. I mean, the doctor said if I had another heart attack, it would be more severe, and because I'm feeling so tired, I do worry that doing exercise is going to make me more likely.
The cardiac rehab is guided and coordinated by physiotherapists who are trained into this field, and that's what they do. They're experts at rehabilitating people who have undergone the same problems as you have, and are recovering from a heart attack. But on top of the exercise, we do have to address a few other things, and that is the other contributing risk factors to developing another heart attack. Please don't worry about that, because if you change your lifestyle, your chances of having another one are quite low, especially if you find ways to maintain normal levels of cholesterol, and losing weight, and strengthening your heart, as I said, by graduated exercise coordinated by a cardio rehab physiotherapist.
Thank you.
Yes.
That's the end of the role play.